Hi, everyone. My name is Nathan here at QuickBase, and I'm extremely excited to be able to talk to you today. We all know that there's a global pandemic going on, and it's safe to say that none of us have ever been through something like this. And so, with that being said, we're all figuring this out together. And unfortunately, we don't have the luxury of time, and that's what we're racing against. Is how can we try to do our very best amidst all of the challenges that are going on to be able to help contribute, to be able to serve the public, to help people get vaccinated who wish to get vaccinated. This is something that is uncharted territory. And when things are uncharted, we tend to look in all directions for potential solutions. And unfortunately, this is such a massive undertaking that there isn't something that is really jumping out to say, hey, I have all of the answers. And at QuickBase, we saw that as a challenge. We wanted to take it upon ourselves and work with other state and local governments to see what are the biggest things that you're facing? How can we help you overcome that? And how can we do that now? We don't have months, we don't have years, we need to do it now. And so with that being said, I'm extremely excited to talk to you today about a vaccine distribution management system that we have come up with in conjunction with peers here at QuickBase, as well as other state and local governments that have given us their valuable input so that we can bring this home, give it to others, help them serve the public, and ultimately, let's bring an end to this global pandemic. So without further ado, like I said, my name's Nathan, and I'm extremely excited to present to you something that's customizable. It's a fast start software solution that gives you the visibility that you need into what is happening within your communities and how you can best solve for the challenges that it presents. So with that being said, I want to talk to you today about the agenda. We're going to talk about the existing vaccine management software, or rather the challenges. And with that being said, there really isn't existing vaccine management software. So what are the challenges that surround taking softwares and trying to mold them into really what they're not meant to do? And that's difficult because we find ourselves patching with different pieces of software or programs, and it's really hard to provide a cohesive experience. So we're going to talk about the challenges that that brings and how we can solve that. Additionally, we want to talk about the benefit of a low-code software for your vaccine management process. A little backstory, I used to shy away from code if at all possible. And over the years, especially after I found QuickBase, it has really made me more comfortable to be able to have the confidence to do what I need to do without having to know how to code. QuickBase really brought that to light for me. And I'm excited to share with you what we have to offer without you having to feel like you need to be able to know how to code. This low-code platform is specifically built for people like you to be able to solve today's most complex challenges and to do it with as not near as many resources as you would need to otherwise, and to do it fast and to get it up and running very, very quickly. Number three, I want to show you the demo. So it's a ready-built template. It's been inspired by peers and best practices, and we'll be able to dive right into it and you'll get a sneak peek of what it looks like. So really with the application, there are two main capabilities that we are focusing on. There's the public capabilities, and then there's internal capabilities. So with that being said, the public capabilities, really, there's one primary thing that you need to do. You need to be able to register. What does that look like? So the public capabilities allow you to register and be able to receive your COVID-19 vaccinations, shot 1 and shot 2. Or with these new vaccinations coming out, potentially just 1 shot. But we need to be able to manage that. So the public can register. We need to make that easy. The public within this application can also manage their appointments. So they can receive, cancel, and reschedule appointments all very conveniently from within the app. As well as when you're given an appointment, you can submit a screening and consent form. This is crucial because you need to be able to run these screening and consent forms before someone is vaccinated to be able to check if they're sick today and any other underlying medical conditions. QuickBase has digitized the screening and consent form and allows them to do it beforehand, which in turn speeds up the process and allows us to get more people through the line in a more efficient manner. And at the end of the day, they're happier and they're well pleased with the process of going through their vaccination. The internal capabilities are that the state and county needs to be able to manage registrations, prioritize appointments, and plan vaccination sites and schedules. So with that being said, we want to be able to manage the registrations that the system has captured from the public and have instant access to the registrant's information. So their name, their date of birth, their age, and any other eligibility questions, underlying medical conditions. What's their field of work? Are you prioritized over other people because of that or because of other criteria set by the state or local government? So being able to do that's crucial. So internal capabilities, you can manage these registrations. And most importantly, you can prioritize appointments. So within the application that we've built, you will be able to set criteria to be able to pull the people that you need to be able to offer vaccinations to. So simple ones, are you over 75? Maybe the age limit's been dropped to 65. Maybe you want to look at people who have their first dose or their second dose, or maybe people in certain zip codes, or those who are high risk, or, and I'll talk about this later, maybe you want to look at Census Bureau data and look at track information on a more granular level to be able to look at social index scores. These are all things that you have control over so that at the push of a button, you are pulling and prioritizing those who should be receiving the vaccine at the right day and at the right time. And then last but not least, you can plan vaccination sites and you can plan vaccination schedules. So where is it being given at, and what days and what times is it being offered? These are all things that you'll have the ability to manage within QuickBase in a very seamless way. Here are a couple of the benefits that come along with this application. So from the public side of things, and I'll just point out a couple of these. Obviously, you can sign up. This is crucial. We need an easy way for people to sign up, especially the elderly. We want to make sure that it's straightforward, it's user-friendly, and that people feel like they're empowered to be able to do it themselves. We have QR code technology that allows the public to receive a QR code with their appointment so that when they show up on site, they simply show that to you, you scan it, and you're able to check them in right on the spot and verify any information. The system also does email notifications and reminders. And once again, there's paperless screening and consent forms. So we're able to digitize that and really speed up the process. Some of the state and county benefits are you get the ability to have the logistic management. I think that's been one of the biggest challenges is how do we logistically solve this problem? QuickBase is going to be able to bring in the technology to help you solve it logistically. And on top of that, we're able to get real-time reporting and analytics and information that you need to report to the other agencies or other governments that are asking for that type of data. We also have real-time Census Bureau integration, which is really neat and allows you to get even more information on individuals signing up so that you can make the most informed decision as to who is next in line to receive the vaccination. So without further ado, let's go ahead and jump into the application, and I will show you what we've been able to accomplish. So what you are looking at here on my screen is the COVID-19 Vaccination Portal. This is public facing, okay? You could put this link on your website or send it out in an email or however you communicate to your residents or to the public in your area. We have a new way for you to sign up. Go here and you can start the registration process, and look at how simple it is. It says, welcome to the COVID-19 Vaccination Portal. There's really two things you can do here. If this is your first time, go ahead and click the green new registration. If this is if you've already registered and you would like to check your registration status, simply click on the orange registration status check. So let's go ahead and dive into one of these, and let me show you exactly what it is and how easy it is to use. So my name is Nathan. I clicked on the link on the county's website. I'm here for the very first time. I would like to register. I'm going to go ahead and click new registration. Notice how simple this is. There's instructions up at the top that tells me to complete and submit the form below. And everything is categorized. So it's asking for my name. I'm going to go ahead and fill out this information. While I fill out this information, just know how important it is for us to be able to capture this. We need to be able to run different criteria based upon their age group. We also need to know demographics. So where do you live? And then we need to ask the screening, and we need to ask some medical questions just to make sure that we are making sure that we are properly prioritizing people. So here's the address information. This is key because what's really unique about this is the moment that this registration is submitted, it is actually going to ask the Census Bureau, do you have any data on this particular address? And the Census Bureau will respond with any appropriate information. We do that all in real time, right when the registration is submitted. So that's really cool because we're not having to go and manually grab stuff and attach it. This is all fully automated, which makes it so much easier for people to register, and it makes it easier for you to manage. I'm going to go ahead and fill out this contact information. We want to make sure that they enter in their proper email address. So I'm going to enter in my work email address. Notice that if I was to enter in an email address that was .co instead of .com, it didn't match, the system will catch that and it'll ask you to redo it. So I'm going to go ahead and put in my real one. There are these things in place to make sure that we are gathering correct information. I don't have any underlying medical conditions. I'm going to say no. And then we're going to ask for a security PIN. And we can dive into this another time, but this is very important. This is how we make things secure on top of a lot of other things that we've taken into consideration. But we ask someone to set a security PIN. It only has to be 4 digits and it can be alphanumeric. I'm going to go ahead and set my digit or my security PIN as 2021. And that's it. That information is what I need to be able to register. I'm going to go ahead and click Save and Close. It's going to take me here and it's going to say, thanks for registering. And it'll give you some instructions and let you know that an email is coming from notify@quickbase.com. I can easily click New Registration and I can go through this process again. So if I'm a family of 4, I can register myself, my spouse, and then my 2 kids. So this makes it very easy for you to do it quickly. So this was a real one. Let's go ahead and check my email and see if I got an email from notify@quickbase.com. There it is. It's sitting in my inbox. Let's go ahead and click on it. So it says, to Nathan Call, you have successfully registered for the COVID-19 vaccination. Below is your registration ID, which is important to remember and keep safe. Here's my registration ID. There's also some other information that kind of tells me what I should be looking out for and some instructions. And then you'll notice that there are 2 additional links in here. I can check my registration status and I can also cancel my registration. What's really unique about this system is that the way that we are able to communicate to the public is via email, and everything is done securely by allowing them to perform certain actions. So if we were to come back to this portal and if we were to look at the home page, you would notice that there's that registration status check. If I click on it, it asks me for my registration ID. The reason why we implemented a status check was because one of the counties that we were working with noticed that people were registering over and over and over and over. And it was because they just didn't feel like they were either getting an appointment, or maybe they felt like their name got lost in the ether, whatever it might be, they didn't feel like they had registered. So when they implemented a registration status check, that reduced the amount of people filling it out multiple times, and it allowed people to check their eligibility status, which gives them the security and the confidence that they are in the system and that they are in line to receive their vaccination. So right here, all I have to do is fill out my registration ID. If I come from the email and I click check registration, it will actually pre-populate the registration ID on my behalf because I came from a secure email. So all I simply do is click Save and Close, and it will say, hey, thanks for checking your registration status. Once again, here's some instructions. Look out for an email. If someone came to check their registration and they did not know their registration ID, they can click Forgot Registration ID. Before I do that, let's go ahead and go to my email and look at the registration status check and see what it looks like. So it came in right here, and it says, "Dear Nathan, call on this date at this time. A request was made for this ID, and here's some information regarding your registration. Your registration status is active. Your eligibility status is pending." So once again, I know, okay, I'm in the system, I'm active, and my eligibility status is pending. Now, from a back office standpoint, you have the ability to control registration statuses and eligibility statuses, whether that's manual or in an automated way. We have built out the communication system to be able to send that information from your back office to the public, which gives them that peace of mind and helps them be reassured that they are indeed going to receive a vaccination. So let's go ahead and go back to this page, and let's assume that I forgot my registration ID. I can't remember it. So I'm going to go ahead and click Forgot Registration ID. It's simply going to say, what is your email address that you registered with? Well, I registered with ncall@quickbase.com. So what the system is about to do is it's going to go and look at all of the registrations and say, is there anyone registered under ncall@quickbase.com? And it's actually going to find two people. I'm going to go ahead and click Save and Close. It's going to find me, and it's going to find my wife, Paige, because she's registered in the system. Both of us are registered under one email. And so that's really nice, is that we're allowing families to register under a family email, and they can register as many people as they would like. We wanted to make sure that the barrier to entry was very, very, very low, and allowing people to use one email but manage multiple registrations was a big plus. So let's go ahead and look at my email. It would have found 2 registrations, and it's telling me right here that if I've previously registered and I'd like to check the status of the registration, I can do it again. So you can do this as many times as you like, and it'll keep sending you emails and letting you know where you're at. So if we look at this, I received 2 emails. So it says, "Dear Paige Call," that's my wife. Her registration ID is ending in 2216. And then, "Dear Nathan Call, here's your registration ID ending in 2552. So what we just went through, a little bit of a recap, was I registered. I was able to check my registration status. I was also able to retrieve my registration ID, not just for myself, but for my wife, because we've signed up multiple people under the same email. Last but not least, let's say for whatever reason, I decide that I no longer want to receive the vaccination. I'd like to cancel my registration. If I click Cancel Registration within my original email, it'll take me here, and it will tell me that I'm canceling my registration. It'll ask me for my registration ID, which is pre-populated because I came from my email, and ask for the security PIN. And I'm going to go ahead and enter in 2021. Now you might be asking, well, what happens if they enter in a wrong PIN? Great question. The system will actually notify them that the PIN that they entered in was incorrect and that they will need to try again. Otherwise, if the PIN is correct, you'll receive a confirmation email that indeed your registration was canceled because it passed our security checks. Notice that the confirmation page says your registration cancellation has been received. And once we verify your information, we'll go ahead and cancel your registration. So all of this is very simple and very clear to the person to let them know what is actually happening. Let's go ahead one more time to my email. And here it is up at the very top. "Dear Nathan Call, we've received your request to cancel your registration. This email is to confirm that your registration cancellation request has been processed." So everything that I just demonstrated can be up and running in a matter of minutes on a website. All you do is provide the link, and the system handles the rest of it. That is what is so unique, and the value that this really offers is that we can get you in front of the public and allow them to start registering and get your county up and running in a way that you've probably never seen before. And that's something that we take pride in and that we want to be there to help you with. So that is the registration process. Now, I know there's a lot that I didn't talk about in regards to getting an appointment and confirming your appointment and potentially rescheduling. That will happen after you create a vaccination site and a vaccination schedule, and you pull people who are eligible out of your registration bucket, and you send out appointment emails to them. So let's go ahead and take a look at what the actual back office looks like and what you can expect. And let's take a look at my registration. So I'm going to go ahead and log in. And we are going to go to the back office app. And notice right when we log in, there's some general information here. I can instantly search registrations. I can search appointments. Additionally, I can get insight quickly into how many registrations do we have. What do those look like by risk? We have 58% that are high risk, and we have 42% that are not high risk. Once again, you can see other information about registration statuses, number of registrations by week. Are we trending up? Are we trending down? Why was there a decline throughout these couple of days? Was something not working? Was our website down? There's so many things that you can pull from this by looking at the numbers and seeing what the public is doing. That's the beauty of this, is that you have that insight. And then scrolling down, there's some other reports that allow you to see people who are overdue for second doses, to be able to call them, to get them to come back in, and you can see other information. So let's go ahead and you'll notice some tables up top. I'm not going to go through all of them, but I am just going to briefly give you an idea of how this works and how this ecosystem is tightly knit. So we have all of our registrations here on the top left. Registrations, or rather a registrant, can have multiple appointments, first dose or second dose. Appointments can have a check-in. So if I come in for my first appointment, I get checked in. Come back 2 weeks later, I come for my second appointment, I'm going to get checked in again. So there's check-ins, and then we know that appointments can have, they're going to be tied to a vaccination schedule, which is tied to a vaccination site. So we're going to be giving vaccinations at Utah State University. That's a local university here in Cache Valley. So that's the site. And then the schedule is on Thursday and Friday from 8 in the morning to 5 in the afternoon, we'll be giving vaccinations. That is the schedule. In the schedule, this is where a lot of the magic happens. This is where you say, okay, on this day, we are going to look at all of our registrants who are older than 65 years old. We also want to target people who have only received their first dose. And we also want to look at this other criteria that was just asked of us. This is where you do that, is in the schedule. So that's a little bit about the tables up top. Everything else really is there to provide a more cohesive experience, such as schedule assignments. This way we can know who is working. So like, let's say I'm actually checking people in. I would check into Utah State University as a worker. And as people come and I'm checking them in, I'm able to check them into their appointments at that site. And now you have a list of who was checking in, who was your other staff, who were your vaccinators, just for historical records. So let's go ahead and take a look at the registrations table. Notice that you will see my registration at the very top because I was the most recent one that registered. So instantly I can see some information. On the far right, you will notice it says high risk symbol, and I can scroll down and instantly see who is high risk. Now, you can set this criteria according to whatever you want. As of right now, the system that I have set up, high risk is identified as anyone who has a medical condition that they disclosed as they were registering. So when we actually look into the registration, you will notice that there's a registration ID. We have a unique identifier, and we can talk about that further, maybe in another session. But then there's the registration status, which, by the way, mine's canceled. Remember, we canceled it, so the system reacted appropriately. We can see eligibility status, the age group, and other information such as the date and time they registered. Down below, we will see appointment information. So notice I don't have any appointments. Nothing's been found because I have yet to be scheduled. Down below, we will notice some other administrative information. Notice that I can see, did they check their registration status? Yes, Nathan asked for it at 6:38 p.m. on this date. Have they requested their IDs? Yes, he requested an ID, and it looks like he also requested a cancellation, and the security pin was a match. See that right there, the yes? Security pin was a match, so we went ahead and canceled it because they were verified. And down below is that census data that I talked about. If I look at this, this is just a preview of what we can pull. There is so much more information that we can grab. So be sure to talk to us about that. But right now I pulled in the tract, which is like a zip code, except it's defined by the Census Bureau. And it's on a little bit more of a granular level. And I pulled in other information such as the county, the GeoID, the state, and the name. But that census data is tied to my registration. And it now allows the back office to make more informed decisions based upon the people who are registering. Notice one thing for registration details, that all of my details are here, except the language has changed and it says use their legal name and do this on their behalf. That is because if someone was a walk-in and they came up to the front desk and said, I'd like to get a vaccination shot today, and you said, perfect, we actually have some extras, let's go ahead and input you into the system. Without going through the front end and having it sent over here, you actually can just come in, click new registration, and read it as if you're asking for that information. So can I get your first name? Can I get your last name? And you can fill this information out. And all the same, it'll send information to their email address, and the system continues to work without any bumps in the road. So that's a little bit about the registrations. Let's go ahead and look at the appointments, and let's talk a little bit about this. So here's a list of all these appointments, and instantly I can see appointment type, first dose, second dose. I can see the time that they were supposed to show up, the site, were they actually vaccinated, yes or no? And then I can look at screening and consent forms, and I can easily check someone in. So if we view the very first record for Simone here, you will see their date of birth, their age, and look at this, there's a QR code. These are automatically generated by the system. And so if I receive an email for my very first appointment, there will be a QR code in the email. If I was to show up on site and show someone my QR code and someone scanned it on a phone or a tablet, it would take me right to this record. And then I could verify information such as what's your date of birth, what's your phone number, what's your full name, etc. And I can verify you here. If we look at the appointment details, this particular individual actually completed their very first dose back in the middle of February. So when we look at this, I can see that they were vaccinated. That's checked. It was in the right deltoid, and they were able to, this is the date and time, and they were vaccinated by this immunizer. I can look at screening and consent information, so I can click into here, and I can look at screening and consent. So this asks for insurance information. Once again, all this is completely customizable according to you. If you need to ask it, great. If you don't, you can get rid of it off of the form. Additionally, you can add things that you see fit. And then there's medical screening. So are you sick today? You know, have you received any other vaccination in the last 14 days? This is all available in the screening and consent form. If we go back, the only other thing to actually point out is that, you know, this individual was checked in. I can see the site that they were actually scheduled to go to, as well as the site that they showed up at. One of the things that we found in our studies is that people show up at the wrong sites all the time. And that's not necessarily a bad thing, but we wanted to be able to log where were you supposed to go versus where are you currently at. And we can see the individual who checked them in and the date and time. So also, if someone called in and they're like, I'd like to cancel my appointment, you can actually send them this cancel appointment link. You could send them this reschedule appointment link or this confirm appointment link. This allows them to be able to do it so that it's secure. If you'd like to do it over the phone, you're more than welcome, but know that all of these links are unique to this particular individual. So if they called in, you have that all of that at your disposal to be able to help them do exactly what they want to do. So let's go ahead and just take a look at one who has not had an appointment yet. So, or who has an appointment, excuse me, but has not yet received the dose. So this is a person who's actually been scheduled. I can see that right here that they are scheduled for their first dose today at 8 o'clock. So you can see the site, the address. Once again, there's no screening and consent. So this is a perfect opportunity for me to say, I need to go ahead and add a screening and consent form. And then I'm going to go ahead and check you in. Notice the check-in process is extremely smooth. I say that I reviewed the demographics, that I was checked in. It pre-populates my name, their appointment, the site that they were scheduled at, and the site that they were actually supposed to go to. If for whatever reason there's a discrepancy, QuickBase will tell you, hey, the registrant was scheduled at a different site other than the one that they were currently at. So once again, there is that level of granularity to this. And that is what is so amazing about this, is that you have the ability to take this and you can make the adjustments and any customizations on top of it. You can come in and you can add vaccination sites. So you can see here's the Utah State University site. It's active. It was approved on this date. You can see the capacity at the site. Is it standard, or is it a drive-through, or is it hybrid? Can we do walk-ins, and can we do drive-throughs? And then I can see the schedules attached to it. So looks like we did something on the 18th of February, and we also have something on within March. All of that is readily available and at your fingertips. If we actually look at one of these schedules, notice that in here, this is where you can edit the schedule information, and you can say, okay, here's the start time, here's the end time. We're going to be going ahead and be giving the Pfizer and the Moderna vaccine. We're able to schedule 400 people, and this is where you say, okay, here's the person's eligible for the vaccine. Notice that these choices are blank. This is where you can bring in your own custom rules. You can then say what appointment type you're targeting. Maybe it's first dose, second dose, or both. You can do age queries, 65 plus, 75 plus, any age. And that sort of information is compiled, and you're able to push a button that will then look at all the registrations, grab the ones that are appropriate, and create the appointments. That is all done through our pipelines technology that we'll talk about later. And that is a custom implementation on for you on your behalf. So we need to be able to set that up, but we do so once we have more information according to your needs and what you're actually looking for as far as scheduling. But with all that being said, you just had a sneak preview into our client-facing portal and also into the COVID-19 vaccine app. Now, with all great things, there are always things to improve upon, and it can tend to be a vicious cycle of always wanting to do better, and do better. And one of the nice things with QuickBase is that we support you along that way, and we go as fast as you would like to go, and we're here to support you. We all strive for excellence. I strive for excellence, but there are always things to improve. So with collaboration amongst counties, amongst peers, we're able to do better. And that is really the goal here, is how can we help put an end to this global pandemic? So with all of that being said, this is trusted by your peers. Here's two counties or local governments that have been using QuickBase, and you can read what they've said. I've worked extensively with one of these, and can't tell you the amount of appreciation that I have for them for actually being in the weeds and doing this, and seeing the struggles and actually experiencing that firsthand. Like I said, we've talked to a lot of people, and we are trying to have a more empathetic outlook on this, simply because you are the ones that are on the front lines, and we're here to support you. So please let us know how we can do that. As you know, QuickBase is trusted. It's trusted in many different areas by the Fortune 500. We're an established market leader, and we have amazing peer reviews. And we're here for citizen development. We're here to help you build and to help you feel comfortable and confident, and really take it to the next level without straining and depleting resources. So with all of that being said, I want you to be able to take all of this in. If you have any questions, please reach out to us. You can go to quickbase.com/vaccine-distribution for more information. Please do so. Don't shy away. We built this with you in mind, and so we want your input, and we want to connect with you. So please find us here. If you have any questions, you can reach out to us. I hope this proved to be valuable for you and that it was something that got you excited, because I know for me and myself, I'm extremely excited about this. I feel honored to have had the privilege to work on it, and I hope that it provides and gives a way for you to be able to alleviate some of that stress, some of that anxiety that might come with trying to solve such a complex problem. So thank you for participating, for watching this, and I hope you all the best, and we will be there along your side for anything that you need. Thanks. Bye-bye.